News now, and there is serious concern about the rapid rise of RSV cases in Colorado. It's so bad that doctors are warning parents of small children avoid holiday gatherings where anyone is sick. Our Bill Folsom looking into concerns. Much more on what we all need to know. This just keeps getting worse, Bill.
It does. So many little kids are in the hospital. The system is at a level called stressed. Numbers are dramatically worse than any recent RSV season. A trip to Children's Hospital for a 6-month-old little girl is a scenario that could happen to any family with little ones.
My son, who goes to preschool, brought home a little bit of a cold.
A mild cough for the 4-year-old grew to an emergency room visit for his sister where RSV was confirmed. It was treatable from home at first. A day later, the baby was struggling to breathe.
They were looking for a bed for her, but South Campus was completely packed. So we ended up being transported by ambulance to the main campus where a bed had opened up.
The number of beds in pediatric IC units across Colorado dropped to just 2 this week. Doctors with children's and leaders at Colorado's Department of Public Health want everyone aware of the RSV situation.
Most alarming this season for it is just the early nature and really just the high level of impact to the community.
This graphic shows what's happening. Each line shows RSV hospitalizations over the past 5 years. The green line on the left is this year. It is steep, showing the fast rising numbers, and is nearly 4 times higher than the worst of the other years.
We are at best still at the peak of RSV, and in the last 2 to 3 weeks, flu has really started shooting up. And so I don't see a scenario in the next month or two where we don't have very busy emergency departments and inpatient units.
Now, there are some telltales with a baby for RSV needing medical attention. Quick breathing is one. Their stomach contracting under the ribs with labored breathing. More subtle is their throat constricting and the nostrils flaring to open way for more air. If you're concerned, call your pediatrician. Children's Hospital also has a dedicated phone line for speaking with a nurse. Rob?
Bill.